Okay, so continuing to pull out additional instruments that we're going to use to get set up for a case. Surveillance marker, really important piece. Again, we have a short and a long version of this. And what this does is it allows us to basically keep an eye out on our main reference array. So it's like a watchdog. So with other traditional navigation platforms, if this guy moves here, the software doesn't give the surgeon any direct feedback to say something moved. So when we activate this guy, it knows the exact distance between the two. So if this gets bumped, the software lets us know. If this gets bumped, software lets us know. So that way the surgeon gets direct immediate feedback and letting them know that they could be off. And so that's most important. The surgeon doesn't want to continue to navigate if their accuracy isn't correct. So surveillance marker goes contralateral to the DRB. So if we're placing the DRB on the PSIS on the right side, then your surveillance marker will be on the left side. All right, so we'll pull this surveillance pin here, and then notice anywhere where you see the post, that means you're going to put spheres on there. And so I'm going to grab a sphere really quickly. And these are NDI spheres, they snap on. So just simply put it over the top, press down. I usually like to press down and give it a small little twist to make sure it's secure. Now that's on there. And so we have to put this into the patient. So we have an impaction cap that we'll pull out of the top of the navigation tray. And we're going to go ahead and snap this in like this. Snaps in. So now we'll hand this to the surgeon. They'll feel where they want to place it, make a small incision, mallet it in, and then they'll snap this off. They snap this off, and now this stays in the patient. All right? So that's our surveillance marker that we'll pull as well. Other things that you'll pull, we have a knife holder here. We can put a 10 blade in here. And so we'll use this if it's a percutaneous case. So this will allow us to make that incision precisely where we want to place that screw at in alignment with the trajectory that we've created. So we'll pull this. And we will also pull, so there's two different types of workflows. We have our intraop workflow, which involves using the O-arm to take our imaging. And we also have what we call a pre-op CT workflow, where patient gets a preoperative CT, we load that up to the software, we then come in with a C-arm, take AP and lateral shots, and match those shots up to the preoperative CT. So from what I understand, you guys will probably primarily do a lot of intraop cases where you bring in the O-arm, we're going to do a spin, and then that's how your patient will get registered. So if you know you're doing an O-arm case where we're going to use the O-arm registration, then you're going to need to pull this guy here. This is what we call our ICT, that's short for intraoperative CT fixture. So this has to be attached to the patient so that we can figure out basically where the patient is at in the room in relationship to where the DRB is at. So a couple of quick things I want to point out to kind of be aware of is how to actually assemble this. So I'm going to grab that wrench here, and we have teeth here and teeth here. So all we're simply going to do is line up our teeth like that. I can get my teeth to work. So line it up like that. Then I like to flip it upside down. So now I see the spring, and then I'll put my driver in there, and then I flip it back again. So you see the top here. So as I push up, you see that come out, and then I'm just going to give it a quarter turn. Goes back in. Now it's locked in. All right. So that's how you're going to assemble this. I also like to make sure that when I give it to the surgeon, it's either in this position like this, along this bar here where there's no silos at, or on this side where there's no silos at. Inside these silos are these little small fiducials. when the O-arm takes those scout shots or does a spin, it has to see these little fiducials that are in there. So if this is kind of like this, then it just makes it harder for us to pick up those fiducials in there. So in order for us to get an automatic registration, we need the scan has to show at least 5 of these. So there's 7 of them. So I like to just say, you know what, let's just put it along this axis here or this axis here. All right. So the second part to this is this clamp here, which is really important. It's really small, so worst case scenario, this gets lost. And then we wouldn't be able to use this. We'd have to figure out a different way to how to attach this to the patient. But essentially, it's, you know, you're going to need a replacement for this. So there's a small hole here. That small hole goes over that like so. Then there's a larger hole here. And so on that same post that we have our DRB on, so I'm going to lower this a little bit. So in that same post we have our DRB on. Now we'll place our ICT on here as well. So now we would just tighten this up. So it'll look something like that. And so if this will hover over the area of interest for our patient. So the surgeon will adjust this, slide it in or out, rotate it, make sure that this is covering the area of interest that we're working on. So the scan needs to show, you know, let's say we're doing 4-5-S1, scan would have to have those bodies in there, but also we need to have this ICT in that scan as well. So in order for us to get that automatic registration. So that becomes important. So it's easy when we do the scout shots, it's easy for us to get the AB shot. When it comes to the lateral shot, we'll know that we have this in our image if we can see that spring that's in here. So in that scout shot, we'll see that spring. And we see that spring, that lets us know that we're low enough to get all these fiducial markers in there. So that'll be something that we'll be watching, we'll be talking with the rad techs to make sure that, hey, when we do that scout shot and that's the lateral shot, that we can see the spring, that means we can see we're low enough to see all the fiducials. So that's just something that we'll be watching for to make sure that when we do the full spin, we're going to have this entire ICT in that image.